Hello everyone. My data assignment topic is environmental asthma. The purpose of this presentation is to learn about environmental asthma, its common triggers, impact on the US population, effect of pollution on asthma prevalence, death rate in NYC due to asthma, and its cost associated with asthma. Here is the table of contents. We're gonna go through each one, so let's go. Environmental asthma triggers. Triggers can be of various types. For example, indoor and outdoor. Indoor trigger consists of biologic allergens like dust mites or roaches, chemical fumes from paints or corroded paint, products from fireplace in the house. Outdoor triggers are industrial pollutants, pollen in the air, particulate matter. They are also classified as allergen and irritant. Difference between them is that irritants cause a reaction in the body but do not cause immune system to react. So common allergens are pollen, mold, insect parts, animal dander, and common irritants are smoke, dust, and fumes. Prevalence of asthma in polluted cities. On the left is a table of cities listed as being the most polluted and the asthma prevalences associated with them. Environmental asthma is a disease that is often associated more with developed countries rather than developing countries, as they have more industries, vehicles, and a larger population, which contributes to the air pollution. The air we breathe has a serious effect on our health. There has been a significant improvement in air pollution in recent years, but climate change will make it harder in future to meet all the pollution standards. Asthma rates for US. Here is a map of US with color-coordinated asthma prevalence for each state. The number of people with asthma is growing continually. 8% of the US population had asthma in 2009. Asthma attacks can be prevented if everyone is correctly informed about the common triggers and other long-term control medications. Asthma death rate in New York City. On the left, you can see the number of deaths in New York City over the last few years. The highest asthma prevalence rate in New York City is in the African American community. You can read the text for detailed statistics on that. The main reason for this is because persons of color have lower average income than whites and are at greater risk because of living conditions. A recent study conducted by medical researchers at Johns Hopkins stated that asthmatic African Americans receive less health care than Caucasians. This, they said, may be primary reason African Americans are more likely to have severe symptoms. Asthma costs. Total costs for asthma in US was $57 billion in 2007. Living with asthma is expensive. Many people who belong to lower income families might not even have insurance to compensate for the expenses. And even the people that do have insurance suffer from loss of income from being absent at work. Children miss their school days, which in turn leads to loss of education or lagging behind in study work. Here are tables showing asthma costs in New York State and the number of Medicaid recipients in New York City. Notice the areas with the highest number of Medicaid recipients have a larger number of African American communities. In summary, asthma is a lifelong disease. It limits a person's quality of life. If properly informed, most people with asthma can control their symptoms and prevent asthma attacks. People should be advised not to leave house during high ozone level days and take care of atmosphere in the house to keep the triggers to a minimum. Here are a list of references that I've used to prepare this presentation. If you want to read in detail about environmental asthma, you can visit any of these. They are all very good sources. Thank you for listening. Have a great day.